I'm going to record. Hello, and welcome to the June Substack Q&A. These calls are really open. So if you guys have specific questions, please, you can just raise your hand. You can pop it in the chat and I'll answer questions like that. And then if we don't have questions, I have some questions that have come in through other means that I will address. So Shelley, you have the questions that I had from before, correct? Yeah.
I
Okay.
do.
So you can, if you just drop those in the chat, so then I have them
Okay.
if we don't have other questions. So Naz, did you have a question that you wanted to ask to start?
Yes, thank you.
Hey,
So
Jess.
there was some confusion that like in me because I hear different perspective about coffee and coffee enema. And I was wondering if you have any um, particular view about that or research that are aware.
Yeah, so coffee enemas can be a helpful way to detox the body. Um, I have some clients who do coffee enemas, but it has not been like a big push within my practice to do that. But I question for you is what are you, so you're hearing conflicting information like to do it versus not do it. Can you give me a little bit more information so I can speak to that?
Actually, the conflict is within me questioning, not that I heard from anything, because we want to make our body alkalize when we're dealing with cancer. And coffee, we all know, is acidic. And I'm wondering how much of that gets observed in the body
I
and would
see.
not be something we want to do. Although I know about this healing center in New York that is like the must if you join in once in the morning, once at night. But so and they're treating cancer. So that's was you know
Yeah. Yeah, no, so okay, so that's helpful in terms of the question. So the question is about coffee enemas and is this good? Because with cancer, cancer thrives in an acidic environment and coffee is acidic. So with coffee enemas, the centers who use this, they usually do it like you described twice a day. So with the coffee enemas, and the idea is to help detox the liver. And so basically it's coming up in through the colon, obviously. There is not a ton of systemic absorption in terms of worrying about it shifting the acidity of the pH in your blood, but it's basically to help the liver cleanse and detoxify, which cancer we know is an imbalance of toxins. And basically, we've got too many toxins and we don't have enough of the right nourishment. And so, coffee enemas can be actually an effective way to detoxify the body. So, what I would say is yes, it's an option. Do you have to do them? No. There's like other things that you can do as well to detox, but coffee enemas are one thing that is used within the cancer space effectively to help detox.
great. Thank you.
You're welcome. And but the one thing that I will say is doing it twice a day is a lot to start. And so if you were to do coffee enemas to take that on slowly and kind of build up and not jump into doing it twice a day. So I would do it a couple times a week, like 3 times a week, and then build up to daily before you go into twice a day. Because this is one of the things that I think is really important when we talk about detoxification in cancer. Yes, detoxification is important, but when you have cancer, your body is compromised. And so more is not better. And so, what I tell people is to be really listening to their body. And when you go into a detox program, and doing the coffee enemas is a detox, is to ease into those things gently so your body has a chance to acclimate and you're not just like causing this massive detoxification in your body when your body is already, really using all of its resources to heal itself already. So that would be my only thing is I think sometimes people think, and this is like in Western therapy, we think like the more aggressive, the better. But the problem with this is that gentle can be equally as effective, and I think gives you a chance to stay tuned into your body while you're doing that healing, rather than just blasting with, the most aggressive detox or the most aggressive therapy.
Makes sense. Thank you.
Yeah, of course. Does anyone else have a question? I have a few that I can go through from, oh yeah, Eden.
Okay.
Hi.
So my question is, after listening to most recently the one on cancer as a metabolic disease and the water fasting one, two questions, or one question really came up, and this is kind of related to the previous question, just in the sense that I realize, like, I take all these supplements, which I think are really good for me. And I mean, I've noticed an improvement since I started taking them like a year or so ago in cognitive function and energy and stuff like that. But after listening to those, one point was made that when you're feeding yourself, you're also feeding your cancer. And that you have to be, so I'm just wondering if, like, should we be more cognizant of, everything that we're taking, and that maybe it's not the time to, do we need to look at like every single thing and think and see what, should we be taking it? Could it also be, something bad at this time, or not bad, but also feeding?
Yeah, supplement. Okay, so the
Yeah.
question is like really about supplements and looking at what we're taking into our body. Should we be really reevaluating everything when you have a diagnosis of cancer? And the answer that I would say is yes. I think that you should be looking everything. And the other thing is, I take a little bit different approach to supplements. So, and you have to understand there's kind of some different camps in the alternative space for healing cancer. There's the functional medicine space, which is heavily into testing a lot of different things and supplementing everything. So, really looking at the micronutrients and supplementing a ton of those things. And that is a functional medicine approach. And I think of functional medicine a little bit like Western medicine, but using supplements and lab testing. Like, it's different, the treatments that they're giving, but the approach is quite similar. It's very much diving in and looking at all of these things and measuring all these labs. Then the approach that I take is more similar to an integrative approach, which is less testing and more tuning into your body and what your body needs. And my approach to supplementation is that I do believe we need supplementation. Can we have everyone go ahead and put yourself on mute just so we don't have any feedback coming in? But basically is that when we're eating the right foods, we don't need to supplement everything, right? We don't need to supplement all these things. We need to supplement a few things that support our bodies in doing the right thing. But I think the first most important thing is getting your nutrition and diet correct. And then we use the supplements to supplement what we know is deficient based on our diet today with the nutrient. The food just doesn't have the same nutrients that it did before. And it doesn't mean that we have to supplement everything, but there are some things that if we give our bodies the right nutrients, the body actually makes those things. Like, for example, hormones. And people think of cholesterol as being bad, but cholesterol is really important for supporting our body in the like fat soluble vitamins and also in our hormones. And that when we get our nutrients correct, our body makes the things that it needs, right? But then there are some things that the body may have trouble making, or maybe you have an MTFR, problem with methylation or something, and then we need to add, folate into your supplementation or whatever it is. So there are things that need to be supplemented, but my approach is to start with the diet. And coming to your question though, coming in, say you haven't changed your diet yet, right? And you're taking these supplements, I think it's always a good idea to look at the supplements and remember why it was that these were prescribed, or what it is that I'm taking those for, and then really looking at and seeing like, okay, is this helping me right now? And I'll give you an example. Glutamine, it's not the one that normally people take otherwise, but I do know that I had a client who was getting chemotherapy and had neuropathy, and the medical oncologist recommended glutamine. But glutamine is actually a nutrient for cancer. So we definitely don't want to be supplementing with glutamine. So there are examples of supplements that are, frankly, you shouldn't be taking if you have cancer. But what I would say is I would really get clear on, why did I start taking these in the first place? And for those of you who've seen me, this is definitely something that we can do together, is go through your supplements and look at, okay, what should you be taking? What should you stop taking? And one of the things that I find is people either come to me and they're like, I have no idea why I was taking these. I was just like taking them, and then we just kind of strip clear and we start over. And I'm like, okay, these are the ones that you need. This is what we're doing, with a dietary standpoint, and kind of get a good plan. And then other people come to me with 1,000 things that they've been prescribed by different providers within cancer. And sometimes I'll leave a lot of them because I just don't want to disturb what they're doing, as long as it's not dangerous. But I would say there's such a broad spectrum of the way people take supplements and what they do. My approach is more minimal. Like, supplements should be supplementing. They shouldn't be replacing all of our nutrients. So does that answer your question from that standpoint? Yes. Okay. Yes. And then what was the second part? You said there was one about the metabolic and then one about fasting.
I was just trying to remember where my question came from, because it was kind of, I guess the second part of my question too was that what they meant was just similar to with the extra supplements or whatever, but also like when you're doing the fasting, that you have to rest. So your body is supposed to be resting to heal. So I guess I was also wondering too, would that also translate to, finding, obviously we need to exercise to be healthy, but maybe it's not the time to do super strenuous, exercise or something like that.
No, actually, I'm so glad that you brought this up, because this was on my list of things to talk about if there weren't any questions.
Okay.
So I think that we are confused in society about exercise and how much exercise we should be doing. And I think actually we need less than what maybe has been said. And so for me, what I recommend is 30 minutes of walking every day. And if you can do that, like first thing in the morning as the sun is coming up and you're catching the red light, so that you're helping with your circadian rhythm in addition to moving your body, that's amazing. So like early morning walk or late evening walk, or whenever you can get a walk in, I would say walking 30 minutes is absolutely something that you should do. The other thing is that I don't think we need to do a ton of strength training. And like, I've explained to the people who were in my workshop series that after my nutrition workshop, I was like, okay, I'm going to do this. I'm going to do a GKI of less than 2 and really look at this, because I don't know anyone who's actually done this, like as a client, like gone and worked within a program to like get their GKI less than 2. We've done it with some clients, but I don't know like other programs that are doing it and how they're doing it. So I've been doing this experiment with myself. And one of the things that I'm learning is that doing like squats after a meal is a great way to lower your blood glucose and actually help keep you in a low GKI. And so now what I'm doing is after I eat, it's a little hard because it actually helps me not overeat, but I do 40 body weight squats. So no weights or anything, but just like spread so that you're not like super close. Your legs are probably out at like shoulders widths or a little bit further. And just do body squat weights and making sure you get all the way down so that your thigh is parallel with the ground. And you probably 40 is a lot to start, but even if you just did 20 after each meal, what that does is that blunts the blood sugar spike. So anyone here who's used a continuous glucose monitor will realize that when you eat, if your blood sugar starts to spike and you go for a walk or you start moving, it will blunt that spike. And so basically, I personally think that if you walked every day and you just did squats after you ate, I don't think that we need to do more than that. And honestly, it's interesting. There's a woman on Instagram. I don't know what her name is, but she has stage 4 breast cancer. And she's running all these races, like running 5Ks and 10Ks. And in one day she was doing two, and she has metastatic breast cancer. And like everything inside me wants to say, like, it's too much. It's too much for your body, you're stressing your body. And I know she's not doing that. She's doing that because it brings her joy and it's like what's fueling her. But I think with exercise, we need to be a little careful. So that's kind of my thought. I think be gentle with your body, listen to your body. This is like your body needs more rest when you're healing than otherwise. And so if there's a day where you really don't feel like exercising, it's okay. But I would, if you haven't been exercising, making a routine and a habit of is, really important to start. So doing like building up, if you're not doing 30 minutes, start with 15, but getting up to 30 minutes a day. And then adding in body weight squats if you wanted to do them after meals. I think that's like a fold benefit. Like number one, it's getting you some strength training. Number two, it's helping with your blood sugars with what you eat. But if you don't want to do them around your meals, doing body weight squats every day, just doing like, I would say probably if you could build up to doing like 75 to 100 in a day, that would be amazing, like in the morning and then in the evening. But after the meals gives you that kind of added benefit. But I'm glad you asked that, because this is something that I see is that people think that exercise, again, it's kind of that more is better. Well, if being fit and exercising is good, then during cancer, it's probably good to even do more. And I would say no, I would say err on less.
Okay.
Yeah. Anyone else want to open up with a question? Oh, Clarissa's out walking right now for 30 minutes. I love it. Yes, Jess.
Hi.
Hi.
So you said something kind of interesting, and when you answered the first question about like wanting to like throw the kitchen sink at something. And I think I know for myself, if I'm stressed about something, especially with my health, I'm like, what do I need to do in order to like make this thing go away as fast as humanly possible? And so I'm curious, like how you guide people to find a balance between like the doing, because I think we're so conditioned in Western society to do versus like the being and like the resting. Because I know for myself, sometimes if I let myself rest, I feel guilty or I feel like I'm doing something wrong. Like, how do you balance that while going through treatment of some kind?
Yeah. No, thank you for that. That's a very good question. And one of the things that I think about with the way that I'm approaching healing in conscious oncology, we've talked about this, but the idea is not that any one of these things is going to make or break your healing. Like any one of these things is not like the answer. It's putting together a comprehensive plan that addresses all of the areas of your life that need adjustment. So detoxifying things that are not healthy for us and nourishing ourselves with things that are truly nourishing. But it's all about the way that you do it. And that I would say you can do all the right things. And I can tell you, I see a lot of people, and this was more in my practice before, but people who were, super fit, eating what they thought was the right diet, like really being careful about everything they eat. They don't eat any sugar, they don't eat anything. And actually, Anita Moorjani is an example of that. So Anita Moorjani is from the book Dying to Be Me. And she basically was so afraid of getting cancer that she was eating like a completely vegan diet. She was avoiding anything that could potentially be carcinogenic because she was so worried about getting cancer. And lo and behold, she ended up getting lymphoma. And I think it's just as much how we're doing things as it is what we're doing. And actually, in my practice, I really focus on helping people dial back the stories about the doing. Like, you're not going to get it right. And even with diet, I'm like, when you're doing a cancer, treating cancer as a metabolic condition, this is not like going on a diet to lose weight to go on a trip. So you're going to look good, that we're going to just like go after it and just go crazy. No, like 80% of the time. I mean, initially we do like want to get you into so that you're not addicted to sugar. And you know what I'm saying? There's a little bit of like probably 4 weeks of like where you have to get these things out of your system and you have to be kind of strict. But that's not this. Like, this concept of healing yourself is more like 80-20, and that you're gonna live your life. Like, I want you to enjoy your life. I want you to have a piece of chocolate cake when you go to a party and enjoy it, and not feel like, oh my gosh, am I doing something wrong? Am I sabotaging? Am I, is this going to cause my cancer to grow? No. It's like, it's okay to have those things occasionally. But what I'm wanting to teach people is like, we're changing the way you live your life, which is not only things you do, but the intention with which you do them. And so it is, I would say, maybe even more important, the energy to which we bring to the things that we do. And actually, like with, we'll just use fasting as an example. Like, if someone is really resistant to fasting and is like, all the things like in their mind, and they're like, it's going to be so hard and it's this, and I've never done that before and I can't, let's not fast. Like, I don't want you to fast. If that's what is going through your mind, let's get you to a place where like, we're do 16 hours, and then we expand it. But like, I really want people to feel good about the changes that they're implementing, and not that they're forcing their body into something that doesn't feel right. And so sometimes that means you need to take baby steps, and we work our way. And that is really the goal. Is like, the goal of this is to work your way into a new lifestyle that is nourishing you and removing the toxins. And the other thing, in Western medicine, they talk about this a lot, is that cancer doesn't develop overnight. It takes years, right? So this is a process that has developed over time. And so we're not going to fix this overnight, all of the problems. We're going to address them to get your body to a place where it has all of the resources that it needs to heal, but it's going to take time to do that, and being patient and trusting. And I think but it makes sense to me. People are afraid. They're like, I want an answer right now. Like, it's even more dire than the going on a diet that they want to lose weight. It's like, no, I need to solve this problem right now. And I understand the urgency of that, but that energy, if you bring that to your healing, resistance, what we resist persists. So basically, we're bringing resistance into our healing. So it's like, kind of just loosening up and being like, okay, all right. Like, and I think part of this is what I'm wanting to do for people, is help create a path that they can trust and feel confident in, so that I think this is a lot of us get really nervous. Like, is this the right thing? And then you jump from one thing to the next, to the next. And what I would say is taking it slower and doing one thing at a time, and getting one part of your life cleaned up, and then moving to another is a better way to do it in terms of the overall well-being that it brings to your body. Does that answer your question?
Yeah, totally. Thank you. I think too, sometimes just thinking, like, you almost feel like you're trying to beat a clock of some kind. So I really like that idea of like going slow, like every single day, it's like compounding interest in a bank account, like it all adds up, in the same way it got you to where you are, it'll add up in the other direction too. So thank you.
Yeah.
That's awesome.
Yeah, you're welcome. And also, if you think about it, Western medicine is like that fast approach. Like, that's that, in Western medicine, we give a pill for things to fix them because we want things fixed fast. And so chemotherapy, radiation, surgery can be this like very fast approach, but at a cost, right? Because yes, we've killed cancer cells, but we've also now hindered the body's immune system. And so then there's this rebuilding. So even when you think about it, people think, well, like Western treatment is going to be that fast acting, but it's a fast killing, and then there's a slow recovery. So all of these things have a recovery. It's just that you may not be seeing the full kind of trajectory of that, like what it looks like. And so I think that the idea of slow and steady sounds different, but the truth is that anything is going to take time for our body to heal and recover. Does anyone else want to open up? I have a couple questions from that came in before, but if someone has something who's on the call, just feel free to open up or drop it in the chat. Okay, so the first question I already kind of answered about the metabolic approach. Do I need to eat strictly like this forever? And the answer is no. Like, my goal is to help you guys like develop an 80-20 plan where you're doing, you know, what we know to help with healing the cancer 80% of the time, and then 20% of the time you enjoy yourself and you're not, you know, worried about that. Alcohol. So this is something that comes up a lot with cancer. And, you know, what's interesting is the data is conflicting. Like, so there's some things that say never drink alcohol ever if you have cancer, and others are like a glass of wine is fine at night. And this is what I would say is that alcohol, if you're actively healing cancer, like meaning that, you either are doing some form of treatment or you are basically, you know, within, you know, the first few years of being diagnosed, it's probably a good idea to eliminate alcohol. But from a carbohydrate standpoint, it's basically just straight sugar. And so you're going to see your blood sugar will spike with that. And if we know that cancer ferments and uses glucose, it's just like one more thing that you're kind of giving. It's kind of like eating sugar directly. So that is the reason why I would limit it. But I would say, again, it's like the 80-20 rule. If you once a week want to have a glass of wine and that feels like good for you, that is okay. It's just that I wouldn't be doing it every night. Okay. And then also, like, you know, if you wanted to drink, you know, and you want to limit the impact on your sugar and your ketones, doing something like a vodka soda is a, you know, lower glycemic index. So there are things that you can do there. If you want to go out, you know, I'm saying you're going out with friends or whatever, and you want to have a drink or something, that's something that would be low glycemic and have a lesser of an impact. But like a glass of wine with a meal once a week is probably fine. Okay, so another one that had come up was talking about talk therapy. So I talk a lot about emotional release and emotional processing, and, you know, regular therapy, like talking to a therapist, is something that a lot of people do. And so the question is, why am I not talking about that? Why am I not, you know, encouraging people to go to talk therapy? And what I want to say is that I'm not discouraging that, but I will say that talk therapy takes time. So it's something that is that people do over time. And then it also brings up stuff to the surface to on a conscious level. And that can be require energy of processing that on a conscious level. And that when you're sick, this is kind of like coming back to the exercise question, is that when you're dealing with cancer, it can be challenging to do that kind of work, that you may not have the reserves to do that kind of emotional work that is talking about it, bringing it up. And that's why I find the subconscious work, like with Psych K or emotion code or using biofield tuning to help release kind of things, blocks, can be easier for people because they don't require that energy to go back in and talk about things. It's more releasing it from the subconscious and lightening and lifting. And for those of you who are in my workshop series, like I talked about in the emotional workshop, the emotional work, the whole point is to feel lighter. If you're doing work, and let me just say this though, so like Psych K session, so when you do a Psych K session, I usually block 2 hours after that session so that I can sleep or rest before I need to do more work. So the sessions themselves can be a little taxing and you can expect to feel tired and then you'll come back. But so that's normal to have a little bit of recovery afterwards. But if you find that you're doing some kind of therapy and that you're feeling like, oh my gosh, it's bringing up a lot of stuff and it's like, I'm feeling heavier from it, this may not be the time to do that kind of therapy, because healing requires us to lighten our emotional burden and feel like we have less of that weight on us. And this is one of the reasons why, in my experience, talk therapy can sometimes be challenging when people are going through treatment. But at the same time, sometimes it's helpful just to talk through the experience, because the experience of having the cancer can also be traumatic. So having a way to talk through all of that that keeps you moving forward and lightening, I think is important. And I don't know if that's like, does that make sense to you guys, why talk therapy could be challenging during treatment? Okay. And the other thing is that this question came up around the subconscious, is like, why am I talking about the subconscious so much? And so I wanted to explain a little bit about the subconscious and the conscious mind. So we have really two parts of our brain. We have the conscious mind that is aware and verbalizing what we are thinking and coming from our higher level of our brain, right? And this is the stuff that we say out loud, like that we're, I want this in my life. And you let's just use an example of like, I want to have a healthy relationship. I want to have a loving relationship in my life. So you saying that and knowing that you want a healthy relationship in your life is your conscious mind saying, this is what I want. Okay. But we have this other part of our mind that is programmed in early childhood. So between ages 0 and 8, our subconscious mind is just like a tape recorder. And it doesn't know good from bad, right from wrong, anything. It has no like labels of what's good or bad. It just literally is recording. So when between ages 0 and 8, our brain is in what's called a theta wave state. And it's basically just recording. So it's recording everything we're seeing, experiencing, feeling, smelling, all of it. And it's just recording and basically setting up this recording that this is what we can expect from the world. This is the environment that we've been born into. And it basically programs us to be able to survive in that environment. Okay. I don't know about you. Parents, I think like all of us, I'm a parent included, like we mean the best. My parents meant the best, but all of us get fed information that is not helpful, frankly. And I know that I've done this to my kids too. It's not intentional. It's just the world that we're living in. But our minds are like recording this information. And what happens is that, say that you are witness in your family to a relationship that is totally unhealthy. So your parents' dynamic is totally an unhealthy relationship. And that's all that you see, right? So in your early childhood, that's all you get. That's all you have it as an example. You grow up and you're like, I want a loving partner. I want someone who's going to treat me respectfully and kind. But what we have in our subconscious that drives 95% of our behavior and our thoughts come from the subconscious, which was this recorded story that is not healthy at all, right? And so what happens is that even we can say, I want a healthy relationship, but if what you have programmed into your subconscious mind is something opposite, you basically are going to recreate that and sabotage your desire to create a positive relationship, because the programming that you have was just counter to that, right? And so the subconscious is so important because it drives 95% of our thoughts and behaviors. And so this is why so much of the time we can want something and we can be clearly able to articulate what it is we want, but then we're like, why are we doing these behaviors that like basically are sabotaging that? And this is because of the subconscious mind. So in the work that I'm doing with people is I'm helping to shift the stories in your subconscious mind and also release some of those things that have been trapped in there, like emotional trauma, so that we can match your subconscious mind with what you want on a conscious level, which is happiness, right? Which is peace, which is loving relationships, which is healing in the body. But when you match those things, match your conscious desires with the subconscious, you now are aligned and you're much more successful in getting what you want, as opposed to just fighting, like being in this battle all of the time. And so that's one of the reasons why I talk about the subconscious so much, is because it drives our behavior and we're not even aware of it. And it's not like you have to go back and like dig up like what is my whole childhood and all of this stuff. But when you see the patterns, you can tell what's been programmed. And you know how you can tell? Look at your life. What does your relationship look like? What are your, what does your health look like? What are these things have been programmed in you and you didn't even have a choice about them, and you're recreating those things. And you can just look around in your life and you can see. And for myself, like I could see clearly, I was like, oh wow, like I am just, even though I know better, I'm recreating a lot of these same processes or whatever dynamics that I had experienced as a child. And so what's beautiful is that it's really easy to reprogram the subconscious mind. There are multiple ways that you can do that. You can do it with hypnosis, Psych K. You guys know that I'm a huge fan of Psych K. But those are two ways that you can program the subconscious mind. Next week on the podcast, I have a hypnotherapist coming on, and she has actually a great little exercise at the end of the podcast that you can do to help with reprogram the subconscious mind. So that's that one. Anyone have anything else? There was something else that I had that, oh yeah, Eden, you have another one, please. Oh, you're on mute.
This may sound like a silly question, but I'm like, what is it exactly? Like, I'm curious if like, what is like having cancer? Like, what is the exact like, do I have cancer, or do I have, in other words, since it was found after surgery and, was microscopic, supposedly it's all gone. And all the other tests I had afterwards, there's no evidence of it. So I'll be followed. The plan is to follow me for 2 years. I mean, I feel like I have to treat it like I have it, because obviously I got whatever, I had. But I'm just curious, like, for like a mindset thing or for an actual diagnosis, what exactly would my status be right now? Like,
Yeah.
do I have it or don't I have it?
Yeah. So the example is like you have something that has been removed and there's no evidence of anything else that can be seen in the body. I would say there's no evidence of disease, right? And this is, I think, where we get mixed up in Western medicine, is that, people are like, oh, I have no evidence of disease, so then it's all gone and then I can just go back on with my life. But the reason why what we need to focus on is not the cancer per se. The cancer was a sign. Our body doesn't grow cancer unless we are out of alignment, not giving our body what it needs, have too much toxicity, right? So yes, the cancer is gone, right? There's no evidence of cancer. And so now what you're focusing on is how do I support my body so that my body won't grow any more cancer, that my body becomes a host that is inhospitable to cancer growing, right? That is the whole name of the game, is that we are looking to support our bodies so that they will not grow cancer. And I think like in Western medicine, we focus on the cancer, right? And disregard the human who grew the cancer. And what I would say is, I think it's fine. Like, so, I'm not against doing conventional therapy, but it's like, if we do this, then what we've removed the cancer, gotten rid of as much as we can, then it's like we're supporting the body to heal itself and not become a host for cancer in the future. And also this brings me to another point, which you didn't ask, but I'm going to talk about it, is that chemotherapy and radiation are not curative treatments. And I'm sure you guys have heard this, doctors talk about it, and they say, well, the 5-year progression-free survival or whatever is this, which means if it doesn't come back in 5 years, we assume that you're cured. But why is it that they don't say these treatments are curative? Does anyone know why they won't say that? Naz,
Okay.
Naz,
Can
you
I-
want to answer? Yeah.
I can assume that if you continue the same behavior and lifestyle, it can come back.
Yes. Yes. But in Western medicine, they don't even know that, right? They're like, they don't know why you got it. They're like, I don't know, we're going to get rid of it. And then hopefully it was just bad luck and it's not going to come back, right? But you're absolutely right. That is part of the issue. But the reason why it's not considered curative is because the way that cells are killed through chemotherapy and radiation is something called logarithmic cell kill. And logarithmic cell kill just means they can kill most of the cells, like 99.9% of them, but they can't kill all of them. And an example is, like, I'm sure you guys have some kind of antibacterial you've seen on a bottle in the store. It says kills 99.9% of the bacteria, right? Well, why don't they say it kills 100%? The reason why is because it's logarithmic cell kill, and it kills as many as it can. And then it comes down to this point where it can't get every last of the bacteria. And same thing with cancer cells. And the idea is that if you kill most of them and say there's only 100 cells left behind, or maybe 1,000 cells after the treatment, the idea is, well, the body takes care of cancer cells every day. Like, that's what our bodies do. It's like cancer is like a normal phenomenon to have cells that, get damaged, and our bodies just get rid of them, right? So the idea is that the treatments get down to as few cancer cells as possible, and then the immune system will take care of the rest. And that is the idea. But do you guys see a problem with this? Does anyone want to say why that, like, this is maybe problematic to have logarithmic cell kill that also compromises the immune system? Yeah, Jess.
If your immune system is compromised, how is it gonna kill the normal cells?
Exactly.
I'm
So
sorry,
this
the
is
cancerous
the
cells.
cancer cells. This is exactly the problem. So the problem with cancer is we have an imbalance of too much toxicity in the body and not enough proper immune function and cellular function. And basically what has just happened, so you've just killed cancer cells, but you've increased toxicity, right? Because you just put poison in the body, and then you've lowered the immune system. So actually the problem that you're helping, you've actually just worsened in terms of the body's own ability to heal. Now, you've given some treatment to reduce the tumor burden, which probably there's benefit there, right? But it's like, if we don't do anything else to support the immune system, you basically have a host that now is less likely to deal with these cells that are left behind. Okay. And the other thing is that on scans, like, in order to see cancer on a scan, you need about 1 centimeter of disease usually to show up. Let's just use a PET scan. So you need 1 centimeter of disease to show up right on a PET scan. Does anyone have any idea how many cells it takes to create 1 centimeter of a tumor? It's 1 million cells. A million cancer cells for 1 centimeter of cancer. So that means you could leave 100,000, 700,000, 500,000 cancer cells and not see it on a scan, but it doesn't mean that it's not there. And I don't say this to scare you, because the goal is not for you guys to get nervous about this. The goal is just to educate you that if you have treatments, that we want to continue to support the immune system and support your body's functioning after the treatment is finished, so that your body can do its job of getting rid of those cells that are left behind. Does that make sense? Yeah, Naz, not, is it Naz or Naz?
Naz is a short.
Naz, okay.
Yeah. That's it. So I have a question regarding the stages that they call. So I was told it's a stage 0, and yet they wanted to treat it like a full blown up cancer and go like do the max to take it out, do this and that. So which didn't make sense to me. But regard to that, what does the stage 0 really mean?
Yeah. Okay. So, and I assume that we're talking about breast cancer stage 0. So, stage 0, we also call DCIS, which is ductal carcinoma in situ or in situ. And basically, the first word, ductal, just means where it arose in the breast. It rose in the ducts of the breast rather than the lobules. So, in our breast, we have lobules that make milk, and then the ducts that take the milk from the lobule to the nipple. Okay. Most breast cancers arise in the ducts. Only 20% arise in the lobules. So the first word just means ducts. It arose in the ducts of the cancer. These cells arose in the ducts. So ductal, and then second word is carcinoma, just means it's a cancer, means it's like abnormal cell growth and proliferation. But then in situ or in situ means that it's confined to the ducts. And by definition, it can't spread yet. Okay. If it was called an invasive ductal carcinoma, then that has the potential to spread to the lymph nodes and to other parts of the body. So whenever they would do surgery or whatever, they're going to sample the lymph nodes to make sure it hasn't spread. Okay. But with DCIS, the reason why they treat it much like an invasive breast cancer is that if you did a lumpectomy for a DCIS, so lumpectomy is a surgery where you take the tumor and a nice rim of normal tissue to get negative margins. If you do a lumpectomy for DCIS, the risk of recurrence is about 30%. And you're like, why do I care? Why do I care if it's going to come back? If it's not invasive, like, what does it matter? And the reason why it matters is because half of the time DCIS comes back as an invasive cancer. So of those 30% that have a recurrence, 15 of them, so half of them, are going to be an invasive cancer. And what your doctor is saying is, we're going to do this surgery to reduce the risk of you having an invasive cancer in the future. And so usually they will recommend lumpectomy, which risk of recurrence is 30%, half of those are invasive, and then you offer radiation afterwards. That reduces that by an additional half. So you went from 30% to 15%. And remember, only half of those are going to be the invasive cancers. So basically they're saying they want to remove the tumor and offer radiation to basically lower your risk of developing an invasive cancer in the future. But that invasive cancer risk is only about 7.5%. Does that make sense?
Yeah.
And so this is why with DCIS, they treat it a lot like an invasive breast cancer, because they're trying to avoid this invasive cancer in the future. But there is a doctor at in Duke who basically does observation for DCIS, depending on, so the other thing with DCIS, it depends on the grade, it depends on the estrogen or progesterone receptors and all of that. There's a lot of nuances there. But basically there's a doctor there who's saying maybe we don't with DCIS. It's kind of like low risk prostate cancer, right? So like with prostate cancer, we used to just treat everyone. And then we're like, you know what? A lot of these guys with this low grade disease are never going to die of their prostate cancer. Why are we taking their prostate out, or why are we giving them radiation? And we watch them. And so there's this doctor who watches people with DCIS and doesn't treat
Talking
them.
about the COMET study.
No, so not the COMET study is not observation for DCIS without any surgery. The COMET study is is stereotactic body radiotherapy.
Well, I think there is two types. One is just observation. Every 6 months, you have to go back and they do observation. Because I know that that person is also Duke University prop, and I actually contacted him, and he said we recently wrapping up that research, and the paper would be out in a couple of months, which I'm looking forward to seeing.
Okay, but that's it. So it must be maybe their study is also called COMET, but different than there's another COMET trial that's in radiation, the radiation space. Yeah, and it's a woman, it's a female surgeon who's at Duke, but maybe there's a collaborator. I'm curious who you spoke to there, but yeah.
And check actually the name. Yeah, that was Dr. Dr. Thomas Lynch, PhD. That was
Oh, okay. So he's the PhD. Yeah. So she's the surgeon is the MD, but my guess is that they're collaborating on that trial. And does that answer your question?
yes. Thank you.
Okay. Yeah, you're welcome. Any other questions? I don't have anything else. I'm trying to think what else that has come up recently that we've talked about. Yeah, I can't think of anything else at the moment. If you guys did, so no other questions from anyone in here, I think then we will call it. So it was nice to see all of you, and we'll have another Q&A next month in July. It was nice to see you. Nice to see your face, Clarissa, too. Oh, on the beach. Oh, now you're making us jealous. Soaking up the sun. I love it. All right. Good to see you guys. Take care.
Thank you.
Bye.